Sir, di pa po kayo
All right,
nakapag-ahead.
we will be discussing regarding positioning and transferring. This is one of the things that a CNA you should be able to understand. Okay, so I'm just gonna go through a quick run through of this, and then I'll ask questions later on. Okay, again, positioning, it's very important in a CNA or the medical health field. It's defined as planning the person in proper body alignment for the purpose of preventive, promotive, curative, yung pagpapagamot, and rehabilitative aspects of health, or placing the patient in a good body alignment as needed therapeutically. Okay, so once you're in the field, the doctors will use medical terms so that dapat tayo makasabayan, maka-understand. If they will say that, hey, Joshelle, please put the patients in a supine position, who will do that? It will be your CNA. Okay, so obviously, all the preparations, whenever there's a procedure, whenever the doctor will do something, you have to prepare not only the materials but also your patients through body positioning. Okay, so those are the purposes. You can review that later. Okay, can you all say it to yourself lang, Han? You don't have to unmute yourself. Body mechanics. Okay, body
Body.
mechanics. Now,
Fun.
ensuring
Bodies.
proper body mechanics will prevent from ergonomic hazard. Let me write it down. Okay, paulit-ulit ko itong sasabihin sa inyo. Ergonomic hazard.
Ergonomic.
Yes.
Ergonomic.
Yep. So you can choose your patients definitely, but once you are abroad, okay, majority of your patients are bigger than us. Okay. Now, for a small woman like you, how could you probably like raise the patient who is 2 times bigger than you, right? Or move the patient who's a lot bigger than you. So make sure you always, as I've always been telling you, make sure that your safety and your security is your top priority. If you think that the patient is bigger than you and it will be difficult for you to assist the patients in moving or in positioning, ask for help. Okay? Wag bida, hindi kasi Jollibee. Otherwise, what's gonna happen is ergonomic hazard. This is the disease or conditions that you will get from not properly positioning yourself in such a way that you become injured while working. So when you are usually lifting heavy loads, heavy patients, and sometimes pag mali ang pag-body mechanics mo, if you don't observe proper body posture, then it would cause like chronic diseases, and yun, sometimes it could cause your spines to parang break or your whatever, okay? So imagine that just because sa isang pagkakamali na you raise the patient or you move the patients without observing proper body posture, then it affects your life, your career, okay? Pag uwi mo sa Philippines, ikaw na ang patient, okay? So that's body mechanics to prevent ergonomic hazard, okay? So these are the general rules. Number 1, always remember, never lift more than what you can comfortably handle. Okay, in America and another, like in abroad, okay, they are already using a lot of technology. Okay, in the Philippines, I would probably understand that you're using like manual pa, but in another country, everything may mga lift na, may mga hydraulics na that you can use to raise the patients from lying positions to sitting position, from sitting position to standing position. Okay. Number 2, create a base of support. Stand with your feet and shoulder width apart and place 1.5 foot ahead of the other. In other words, you have to like really like do your legs like this. Okay, wag yung ganito, but you have to spread your legs as wide as your shoulder to create a very wide and strong foundation or base. So when you raise the patient which is heavy, so yung energy mo, yung support mo is on your legs. Okay? Next, do not use your back for heavy lifting. So most of the time, kasi we're lazy, we use our back to lift something. Okay? Do not ever do that because sometimes it could cause your back to break or your bones na masira. Okay, you said use your legs. Now, if the bed is low, place 1 foot on a footstool and this will relieve the pressure on your lower back. Okay. Excuse me lang guys, someone's calling me. Hello? Hi? Hi?
1 milligram of epi given. Wanna look at that sponge have us 32.
Okay, next, if the bed is low, place 1 foot on a footstool. This will relieve the pressure on your lower back. Or if you don't have a footstool, just raise the bed, okay? Raise the bed as high as you can. But again, do not forget to lower the bed once you're done with the procedure, okay? Parang ano natin, second golden rule. Number 1 is to raise the side rails. And number 2 is to lower down the bed as low as you can if you're not doing any procedures anymore. Just in case the patient will fall, then they will not have that much of parang effect on their body. Okay? Now, considering a back support belt to protect your back, obviously. Okay. Number 1 position, this is called the supine position. Para lang matandaan ninyo so that you can remember, imagine your spine or your spinal column, okay? If you sleep like this on your back, it's called supine position, okay? So you start applying these terms already in your day-to-day life. Supine, spine, supine, okay? The opposite of supine is called prone position, okay? Parang nakatalikod or nakadapa. Prone position, opposite is supine position, okay? Number 3, side lying. If it's on the right side, you call it the right side lying position. If it's on the left side lying position. Or some other places, they call it lateral recumbent position, okay? Right and left. So basically, it's just moving yourself to the right and to the left. Now, this is semi-Fowler's position. Semi-Fowler's position is parang siyang sitting position on the bed. Okay, if it's too high, yung parang like this one in on the screen in the middle, it's called high Fowler's position. Now this is semi-Fowler's position, but if it's like almost lying down na, okay, like that, it's called low lying Fowler's position or low Fowler's position. Okay, pag sinabi ng Dr. Fowler's position, always think of a sitting position on the bed. So when do we use this? For example, if you are doing oral care, if you're brushing the teeth of your patients, if you're feeding your patients, if you're giving them medicine na kailangan nilang inumin, you have to put them on this position. Okay, if you're giving food naman for like meal time, you have to put the patient on this position at least 30 minutes after eating. Okay. So, or if they're watching TV or in the morning, you have to put them on this position. Okay. Next. Now, this is Trendelenburg position. So if you notice, your head is lower than your legs. What does that mean? Okay, your head is lower than your legs. So imagine if you are in, let's say, for example, an accident, and then you broke your leg, and then it has an open fracture, meaning that you are bleeding kasi nakabukas nga yung paa mo. So if you're standing, okay, the tendency is your blood will just like flow out of your body because of gravity. Now, if wala ka ng blood, okay, what will happen to you? You will die, right? Now, to save your vital organs such as your brains and your heart, okay, para ma-conserve mo yung dugo or yung blood, you have to put the patients on this position. In other words, you have to raise the legs of the patients and lower the head of the patient to conserve the vital organs. So it's okay na your legs will die or will run out of blood or oxygen, but at least you still have your brain and your heart intact because those are more vital organs. Okay, another time that the doctors will use this during the operations. For example, imagine if you're a doctor, guys, and then you will operate on this part of the body. Okay, this, let's say itong chan, for example, like here. Now, this patient is a big patient, right? So with all the fats and the muscles and the heavy like loads from the chest, it's my tendency na it will cover the intestines inside. And if they want to explore this, what they usually do is they put the patients on a Trendelenburg position so that they can explore more on this side and they will have more space ba para hindi siya madaganan ng taba ng mga patients. Okay? The opposite of this is called, OMG, how do I remove this? Annotate there. Okay. The opposite of that is reverse Trendelenburg position. This time naman, the head is higher than the legs, or in other words, the legs are higher than your head. So obviously, this is done during surgery or operations when they want to focus more on the chest part, and then the stomach part will cover the chest, or it will how do I say that in English? Yung matabunan ba, yung chest, then they will put the patient on this position so that they have more space to explore the chest or the upper region. Okay, next is Sims position. Okay, Sims position is like side lying, but this time you have to put some pillows para kang natutulog, right? So you have to put some pillows, and then you have to put pillows on the back of the patient, the side of the legs, to explore on the butt area of the patients. When do we do this? We do this during like enema. Okay, I'm sure maybe my afternoon class, you've heard of this. But for the morning class, enema might be a new term for you. Enema is when you cleanse your colon. So you will insert a tube in the colon or the large intestine of the patient so that they can poop. So whenever you have like diagnostic tests or laboratory tests that they want to see what's inside of your large intestines, they want to make sure that's clean and clear from any feces or stool or fecal matter. So they will do enema to cleanse your colon. Okay. Another time when you're going to do this is whenever you're checking for temperature of the patients using the rectal thermometer. Okay, when you're putting suppositories as well so that the patients can poop, you can also put them on this position, Sims position. Okay, next. Orthopnic position, yung para kang nakaupo na like this, okay? Now, if you imagine, if you put your chest like this, your ribs, okay, hindi siya nakadagan sa lungs mo. Your ribs is not putting a barrier on your lungs for you to be able to breathe. Now, normally, this is advice for patients with asthma or chronic obstructive pulmonary disease. If they can hardly breathe, you put the patients on this position, orthopnic position. You know why? Sometimes it's very sad because there are patients that they have to sleep like this because when they're lying on their bed and then they have respiratory issues, sometimes they cannot breathe and they feel like drowning. So they sleep on this overnight, like sitting down and then their head on their chest like this. Orthopnic position. So if you notice also when you're running out of breath, guys, sometimes you sit down and then you put your heads like this and then you make a triangle on your knees. Yung ganon. So para lang ano yung chest mo, they can open it widely because if you're lying down, your ribs is covering your lungs, so you can hardly breathe. What if more pa if malaki yung dede mo, diba? So also it can like put a weight on your lungs. Orthopnic position. Next, lithotomy position. This is very, very, I think you're familiar with this. When a woman is delivering, they put this on a lithotomy position. But notice this one, guys. On one of the pictures here, what is this? Okay, so sometimes like for male patients, we also put them on lithotomy positions because probably meron siyang mga GU infections or GU surgery, genitourinary infections or surgery. For example, they want to see your bladder, they want to see your kidneys. So sometimes they put a tube or a camera on your penis, okay, going inside just to check what's inside. So that's also a lithotomy position for men. Next. So again, we have your supine, spine, nakatihaya, prone is nakadapa, right lateral, left lateral is side lying position, Fowler's positions when you sit down on your bed, and then Trendelenburg, yung head is lower than the legs, and then the reverse Trendelenburg when your legs is higher than your head. Okay, now on this, I will not discuss, but the use of canes. For the morning class, we will be discussing this for the use of canes. For the afternoon class, we're already done with our demonstrations on how to use canes, okay, and how to use crutches. Ito yung crutch, or in Tagalog, it's called saklay. And then also we're going to discuss about wheelchair, different parts of wheelchair, how to move your patients from the bed to the wheelchair and from the wheelchair back to their beds. Because who will do this? CNA. It's your job to move the patients from one place to another, from the bed going to their chair, okay? So not sure if I already assigned to you, but one day I will be assigning you with a task. You will be discussing regarding this. Also, again, I want to highlight regarding the bed sores. We've already discussed this before. But again, if your patient stays sitting for a long time, okay, and then you forget them to move, then they might be experiencing bed sores or pressure ulcers. And please do not do that. All right, next. Done. Okay. So far, do you have any questions? That's about positioning. We will discuss more when we go back to school. Any questions?
Sir, ako po, hindi ko lang po masyadong naintindihan yung Trendelenburg position. Hindi ko kasi siya naintindihan masyado.
Yeah, yung Trendelenburg position, yung ulo mo mas mababa sa paa. Okay, hindi to usually ginagawa kasi tayo. Usually ginagawa to siya during operations. Okay? So, if they want to explore, imagine mo yung dede mo, yung taba mo sa chest mo, it will cover the tummy area, the stomach area, diba? So, if you are the doctor operating on that patient, so it will parang nakasagabal. Ano ba sa Tagalog yan? Basta, siguro Tagalog yan. Nakaharang, yes, nakaharang siya dun sa chan mo. So if you want to explore, ano ba talagang sakit ng patients ko? I cannot view it properly because yung weight mo from your chest is going to your stomach. So instead of that, they reverse the patient. Ibinababa nila yung ulo para yung dede mo, yung chest, yung taba mo sa chest, it will go back into your face.
Space.
Yes, then you can get a lot of space in that to explore. Okay?
Okay, sir, I get it now.
Okay, thank
Thank
you
you,
so
sir.
much. You're welcome. Next, I'm going to discuss to you regarding medicine, okay? I've already mentioned to you before that as a CNA, we're not supposed to administer medications. But for me as a teacher, I would suggest that you also be educated when it comes to handling medications, okay? So it depends on your sa state mo or kung saan ka man magtatrabaho in the future, but they may allow you to administer medicine or may not allow you. But legally speaking, you should not be administering medications. If your nurses is telling you to administer medicine, it should be a red flag for you. Wait, kasama ba to sa job description ko? Am I legally able to give them medicine or am I not? Okay, so that all those things you have to check during your orientations whenever you're applying for CNA or if magiging CNA na kayo. Okay, but please do not let this stop you from learning about medicine or from exploring on that part, because this is also could be one of your parang chances to improve your career ba. Okay, so you can study on how to administer medicine more fully and then experience para maging license ka na magbigay ng medicine for the matter. Okay. Are you ready? Now, let's talk about medication management. This is also, again, part of your module number 3. I'm just going to do this real quick. So medication, as you all know, medication is any substance that is ingested, iniinom, injected, ini-inject, inhaled, sinisinghot, or used topically, pinapahid in the diagnosis and treatment of the prevention of the disease. Remember, it should prevent or treat or diagnose a disease. Kung iniinom mo lang yan for leisure, for happiness lang, it's not a medicine. It's called illegal drugs, right? Okay, now drugs naman, in general, guys, is a substance that has physiologic effect when ingested or otherwise introduced in the body. The effect could either be good or bad. If the effect is good, then that's what you call medicine. If the effect is bad, then that's what you call illegal drugs or substance, okay? So, lahat pala ng medicine is considered drugs, but hindi lahat ng drugs is considered medicine. Because, again, may ibang drugs na nakakapatay or nakakaaliw lang, okay? Just temporarily. Let me repeat this again. So, not all medicines are drugs, but not all drugs are medicine. Do you understand, Ahmed and Abdullah? Are you here? Yeah. Anyway.
Yes, sir. We understand.
Okay. So it's like an umbrella. Okay. The bigger umbrella is the drugs. One of the classifications of the drug is medicine. Another classification is illegal drugs. Okay. But as you all know, there's already an ongoing debate regarding marijuana. Is legal or not legal? To answer that, some countries classify that as legal, but in the Philippines, it's still illegal to give marijuana as a medicine to cure some diseases. Okay. So what are the purposes of medicine? Number 1, to prevent meaning maiwasan, alleviate meaning mabawasan ang sakit or gumaan ang pakiramdam, or cure meaning magamot, ang mga simptomas, ang mga sakit, or ang condition ng patients. In other words, it's a product produced and regulated to impart a positive medical effect on the patient. All right. So, ang drug ulit is yung mga, alam na yung mga drugs. Okay. Heroin. Ano pa bang ibang mga drugs? You have heroines, you have marijuana, you have ecstasy, you have shabu, you have rugby. Rugby. Sa mga walang budget,
Solvent.
rugby, you have katol. Oh, alam na yan.
Pulkasil.
Ano, paint. All right. So
Excuse me,
these are,
sir.
yes.
Isasend niyo po sa amin yung slide na yan, sir.
Ito, yes.
Sorry. Yes. Okay, thank you, sir.
Para naman fair sa inyo. But usually I don't really send my PowerPoints, but okay, but please don't share this to others or, you know. Anyway, let's talk about abbreviations. RX versus OTC. Ano ulit yung OTC?
Counter, sir.
Over the counter.
Yes, over-the-counter drugs. So these are drugs that are not regulated siya, pero hindi siya prohibited in the market, meaning that you can buy it anytime over the counter. The opposite is RX. When you say RX, that means
Subscription.
prescription. So can you get this anytime in the pharmacy?
No.
No.
Yes, prescription.
So what do you need?
By the doctor.
Yes, you need a
Doctor.
description
Some
coming from the
prescription.
doctor.
Some
Yes.
pharmacy asking prescription.
Actually, no, it's not just some, but all pharmacies should ask prescription if it's
Right.
an RX drug or a prescription drug. Otherwise, they may be, their license may be revoked because they have given medicine or released medicine without prescription.
Without
Ano
prescription.
yan naka-ano yan sila guys, parang meron mga barcodes na it will give heads up to the government that these drugs were released, this number of drugs were released in a specific store or pharmacy or something. Okay, so it's controlled by the government also. All right, now these are the examples of prescription medicine. So I don't want to go through it one by one, but just to give you a highlight, these are the pain management medicine, yung mga pain reliever. So some of the pain relievers, which are yung higher doses, okay, they don't want to give it as over-the-counter drug because some of them they abuse and then it will result to drug overdose. Okay, anything antibiotic is also controlled. Can you read all of this? Can you all read this word?
Amoxicillin.
Amoxicillin.
Yes.
Amoxicillin.
That is the Filipino way of reading it, but in the America and the US, they
Amoxicillin.
they pronounce this amoxicillin.
Amoxicillin.
Yeah.
Okay.
Penicillin. Hindi siya penicillin. Penicillin. Okay? Amoxicillin, penicillin. Oh, dapat ganun na tayo. Okay. Thyroid
Okay.
deficiency, that's also another controlled drugs. For BP, yung mga heart failures, kasi again, your heart is it's a vital organ, so all the drugs that's controlled for, all the drugs that's related to your heart conditions should be controlled as well. High cholesterol, nausea. What is nausea, guys?
No sila.
Pagsusuka, sir. Pagsusuka.
Ang pagsusuka is called vomiting. But
Vomiting.
Hilo, sir. Hilo.
Hilo.
yes, ang nausea,
Hilo.
ang nahihilo, yes, ang nausea is yung para kang nasusuka na nahihilo. Kaya most of the time, N and V goes together. Nausea and vomiting, they like come hand in hand. They go together because most of the time when you're feeling dizzy or hilo, you also feel vomiting, right? So nausea is yung pagkahilo. Okay, now these are the different types of medicine according to the administration. Number one is systemic. This is, simplified lang to guys, so don't worry. When you say systemic, it's all over your body. Once you give that to your patients, the entire body or entire system of the body is affected. Pero pag local lang, it means it's only that specific portion or part of your body that's affected. Now, for example, if you go to the dentist, diba? If you go to the dentist, it's only your teeth or your mouth that's affected, right? Hindi naman lahat ng katawan mo is affected. So it's only local. Systemic is the entire body. So what is that? Number one is oral, yung iniinom natin. What is sublingual? Sublingual is when you put the medicine in the
Under the tongue.
where?
Under the tongue, sir.
Yes, under the tongue. Okay. What is buccal? Buccal is the cheeks. Okay. Ang abbreviation nito is BUCC. Buccal. Okay. That's on the cheeks. Next, parenteral. Pag sinabi mong parenteral, yung pinapasok or ini-inject. Number one of that is yung mga nebulizer natin, which is inhalational. So, para siyang isinisinghot, that's parenteral. Injections is also parenteral. Ang dami palang uri ng injections. Number one is IV. Yung dextrose natin is called IV, intravenous. It means it's inside your veins. Okay? Intramuscular. Remember that COVID vaccine? They inject it on our shoulder here. So that is
Yeah.
intramuscular or IM. Intraarterial, that's also part of your ugat. Intraarticular, that's in your heart. Intrathetical, and so on. So anything that's injected to your body, it's also parenteral. And then the effect of that is systemic, meaning that the entire body is affected. Okay, next. Ano to? What is this?
Tablet.
Tablet. Capsules.
Tablet or capsule?
Ay, tablet.
Tablet.
Okay, mukha
Tablet.
siyang capsule, pero these are tablets. Okay, now these is
Tablet.
Capsule.
capsule. Okay. What is this?
Syrup.
Drops.
Eye drops.
Drops.
Before guys, just to let you know, ang most common of eye drops is like this, okay? Itong nasa left side. But nowadays, okay, because they feel like if you're using this and if you have sore eyes, for example, or conjunctivitis, the area where you have to put on the drops here, sometimes it gets infected. And then once you use it every day and then it's exposed to your eyes, which is infected, you're probably just putting harm on yourself instead of curing your body or your eyes. So instead of that, they're using like this nowadays, okay? So if you have to put eye drops like for 10 days, they will give you 10 capsules or 10 like eye drops like this. It's only one-time use. Pag nabuksan mo na yan and it's exposed to the air, it will be considered
I
as
have to use it.
infected. Yes, so you don't save it
I
para
have
for
to throw.
tomorrow. All right. Now, please remind me, can you look at me in the screen right now? So for example, the doctor will tell you how to put eye drops, okay? Normally what we do is like, we do like this, right? Tingin sa taas or look on top and then like this, and then you put your eye drops, right? Pero the right way for you to administer eye drops is to create a pouch, okay? So parang ganito. So you put a pouch like this, okay? Look up, and then you put the eye drops. Again, you make a pouch, okay? Look up and then put eye drops here. Para your eye drops, yung drops mo will not go out of your eye. So instead of like say when the doctor says two drops per day, so pag nilalagay natin na like this, diba minsan we like make
Going
aluha.
down.
So
Lalabas.
ayun. And then you have to put tissues or give tissues to your patients. Okay, that's eye drops. Next, this is called sublingual. When I say lingual or lingua, it has something to do with the tongue. Pag sinabi mong sub, when I say sub, it means below or under your tongue. Okay, so have you heard of these, or did you see a medicine that's put below your tongue or under your tongue?
Yeah.
Yes. The most famous cataphrase, high blood.
Hypertension meron din, sir.
Yes. Okay, next. This is the injection. So guys, what do you call this part of your injection? Ito. Ano to tawag nito?
Needle.
Needle, okay? Or karayom in Tagalog. What about the middle part? This part here.
Syringe. Syringe.
Yes, correct. Syringe. Okay? And then what about this part? Itong pinupush. It's called the
Pump.
plunger.
Plunger.
Okay, now you will notice when you're already in the hospital that the needles, okay, those needles are in different shapes and in different sizes, okay, and different colors. So, for example, if you're injecting on a baby or an infant, obviously you don't have to use parang a long needle, right? It's only intended for the baby. So, you will eventually notice that the different sizes of the needles comes in different colors. Okay, my blue, my green, there's a pink, there's a yellow, and violet or whatsoever. So as you are parang exposed to that, you will already learn the different sizes and it's different colors. So you don't have to check on it one by one eventually. Okay. Now, what kind of bottle is this?
Vial.
Yes, this is called a vial, okay? Another one is called an ampule. An ampule is long and slim. So it looks something like this. And then there's a parang like that here. You remember this one? Alam niyo yan?
Yes, sir. No, I saw it already before.
Okay. So, but the vial is maliit na mataba. An ampule is mahaba pero manipis. Ano gusto mo? Yung maliit na mataba or yung mahaba na
Still tumatawa.
Oh, Lu.
Yes, sir.
Ano daw ang gusto mo, Lu? Okay, yun.
Wala, sir.
Wag mong i-answer, Lu. Okay, okay.
Baka maano tayo.
Vial
Sorry po
and
tayo.
ampule. Correct. Next. So ito yung example. This is an example of intradermal. Okay. So if you notice, guys, this is your dermis layer, the first layer of your skin. Intradermal, meaning inside your skin. Now, this is called a bleb. Can I say bleb?
Bleb.
Okay. This is used when the doctor asks you, are you allergic to any antibiotics? And then,
When they take
I don't know, doc.
you're allergic, at least in the skin only. You know the circle one? When they
Yes.
take injection, just
they will
to put
ask
the
you to-
circle one, if
correct.
you are allergic to the medicine.
Correct.
You
So
don't
if
know? What?
so here, the doctor will tell you to come back after
See?
15 to 30 minutes, and then they will put a ball pen or mark here, and then when
Yes.
when it becomes inflamed, when it becomes inflamed, when it becomes if there's kati-kati or
15
itches around,
degrees.
then you are allergic to the
Ah,
antibiotic. Okay, it's intradermal, it's called bleb. Next. So these are the different types of injections according to the different parts. Again, intramuscular, it goes into your muscles. Subcutaneous is in the layer of your skin, the third layer. Intravenous is in your veins. Intradermal is in just your skin for allergy testing. Okay. Now, how about eye drops? Can you look at me again on the screen? Now, for example, for eye drops naman, okay, what they will do is they will obviously on your screen right now, they will let the patients lie on their on the part where you have to put the eye drops. But remember, guys, that when you're putting eye drops and we were cleaning the ears of the patients, if the patient's more than 3 years old, you have to pull the pinna up and back, okay? So imagine pag 3 years old, pataas, okay? So ang tenga itataas mo din. So pataas, taas. So 3 years old and above, pull the pinna up and back. It's always back. But 3 years old and below, it's always going down and back. Okay? So going down and back, and then up and back. Don't forget that for ear drops. Next. Kaya naman pala may drawing naman pala ako dito. Pag 3 years old and below, 3 years old and below, going down. Pag 3 years old and above, going up and back.
Going up.
Okay. Now, have you heard of the term side effect?
Yes, sir.
So a side effect is something that you know or something that you are not aware of.
Aware.
Is it something na hindi mo alam or is it something na alam mo na dapat bago mo inumin ang gamot? Anyway, I only have less than 1 minute, so I'll keep that hanging. Please watch the pause video that I've shown you while you wait for me, and then I'll probably send you some more, videos while you wait for me. Okay, we'll see again each other in 10 minutes. Goodbye.
Hi, sir.
Sir.
See you when we see you.